Alright, so we're going to talk briefly about direct access. This is a really important part of what we do around rehabilitation, but really important in physical therapy as well. So a while ago, they started approving physical therapy by state for what's called direct access. That just means that you can go to a physical therapist and receive an evaluation, receive treatment. There are some variations from state to state, and they do change at times, and some insurance companies are a little bit different, so they can have their own rules. But just in general, in the states that we're in, anyone can come to physical therapy without a doctor's prescription, okay? That's really, really important. There's some restrictions by insurance company for some things as far as being reimbursed for it and them covering it, but for the most part, actually for all parts, anyone can come to physical therapy without a script from a doctor. This is a big switch and a big change for the general public and patients. Almost no patients know that this is the case, and almost no doctors even knows. When we go out and talk to physicians, they're even surprised, even though it's been for years that they can do this. It's still something that isn't as well known as really it should be. So we've done a lot of work on making sure that it is well known. This is really, really important for us. What we're doing with direct access is getting the patient treated quicker. A normal course of an injury for a patient is, I have an injury or a problem, okay? I wait, hope it gets better. And then, I gotta make an appointment with my doctor because that's who I go to first. And then, I still have this problem. They give me some drugs and I take those for 30 days. It doesn't get better. I go back to the doctor, and he sends me to get an MRI. It takes me a couple weeks to get in there. They gotta read the MRI, and another, few weeks later, I'm at my doctor. And eventually, maybe the doctor says, hey, you know what, maybe you should try physical therapy. Let me write you a script for that. I'm like, oh, now I can go to physical therapy. We're cutting out those weeks and sometimes months of time in the healthcare system and getting right to the point of the problem, coming for a physical therapy visit, diagnosing it, treating it, and starting to get better day one, okay? So anyone can do that, but that is really such an important part of what we do. And really, you should be talking about this with the patients that are in the office or anyone that will listen, okay? Because like I said, even doctors don't know this. So it's a very poorly, publicized or known fact is that you do not need a physical therapy to initiate physical therapy treatment. Anyone can come to a physical therapist and get diagnosed, without a doctor's prescription. So that's what direct access is. It's important that you understand it and know it, and you can also help out physical therapy by telling other people about it and let them know, hey, do you know you can just go to physical therapy, you don't need a prescription. So it's a big change for us. It really, again, we are educationally, we're trained to diagnose and treat. We have a whole doctorate program now that wasn't even around when I was in school. We're legitimizing what we're doing. All the research legitimizes what we do. So it just makes sense. So you should be able to just go to a physical therapist and get therapy, and that's what direct access is.